Imagine trying to get through your day with the burning sensation in your foot, a sharp pain in your heel, or a general discomfort that makes even basic things like standing unbearable. Foot pain doesn't just affect your feet, it seeps into your life, draining your energy and stealing the joy from activities you once took for granted. What's worse is that it's a lot more common than you think. Studies suggest that 1 in 3 adults over the age of 45 experiences foot pain at some point. So, why does foot pain happen? What's really going on when every step feels like a struggle? Let's explore the most common culprits and, most importantly, how to fix them. One of the biggest offenders behind foot pain is what we call plantar fasciitis. This condition affects the thick band of tissue running along the bottom of your foot, connecting your heel to your toes. When it gets irritated or inflamed, often from overuse, prolonged standing, or even wearing unsupportive shoes, you feel that telltale sharp pain in your heel. If mornings feel like a nightmare because of those first steps, plantar fasciitis could be the reason. Foot pain can also come from sprains, those sudden twists or rolls that leave your ligaments overstretched or torn. Whether it's from a misstep on uneven ground or a sports injury, sprains bring swelling, bruising, and that frustrating inability to bear weight. Structural issues are another common culprit. For some, it's a high foot arch or flat feet, creating imbalances in how weight is distributed. For others, it's more visible deformities like what we call bunions, which often form at the base of the big toe due to tight shoes or genetics. And don't forget heel spots, those tiny bony outgrowths that can feel like walking on needles. Overuse injuries are another major culprit, especially for runners or anyone constantly on their feet. Conditions like Achilles tendinitis, where the tendon at the back of your heel becomes inflamed, can make every step feel like a struggle. And yes, the shoes you wear matter more than you might realize. Tight, unsupportive footwear or high heels can not only cause discomfort but also lead to long-term damage like bunions or plantar fasciitis. Arthritis can cause swelling and stiffness in the foot joints, with osteoarthritis wearing down cartilage over time, and gout attacking the big toe with intense pain. For people with diabetes, nerve damage in the feet can lead to pain and numbness. Even growths like Morton's neuroma, a thickening of tissue around the nerves in your toes, can cause burning or tingling sensations. And let's not forget about fractures, whether for a traumatic injury or the slow repetitive strain that causes stress fractures. So, how do you go about managing it? When it comes to foot pain, relief often starts with the right combination of strategies tailored to your needs. Whether your discomfort is mild or severe, there are several effective approaches to help you get back on your feet. Here are some key methods for treating common foot pain issues. Orthotic inserts are a great place to start. These are specially designed shoe insoles that provide support to the arches, cushion impact, and correct alignment issues in your feet. By redistributing pressure and stabilizing foot mechanics, orthotics can ease the strain on painful areas, such as the plantar fascia or forefoot, while also preventing further injury. Exercise therapy is another cornerstone of foot pain management. It combines stretching and strength training routines to address underlying issues. Stretching helps loosen tight muscles and tissues, such as the calf muscles or the plantar fascia, which can become stiff and painful. On the other hand, strength training focuses on improving the efficiency of muscles in the feet and legs. By enhancing muscle function, your foot mechanics become more efficient, reducing strain on painful areas and providing long-term relief. Manual therapy is all about hands-on techniques to relieve pain and restore movement. This can include soft tissue manipulation, such as massage, which helps reduce muscle tension and improve circulation in the affected areas. Joint manipulation is another key component, aiming to restore mobility in stiff joints and enhance overall foot function. These techniques don't just provide immediate relief, they also improve the way your feet distribute weight and absorb impact during movement. Electrotherapy offers another approach to pain relief. This includes modalities or methods like transcutaneous electrical nerve stimulation and ultrasound therapy. These methods work by reducing inflammation, blocking pain signals, and stimulating overall healing. They are effective for all levels of pain, from mild discomfort to chronic conditions, and can be customized to meet your specific needs. For some, medications like anti-inflammatory drugs, pain relievers, can offer additional support in managing symptoms, particularly during acute flare-ups. Other treatments like corticosteroid injections may also be considered for more persistent cases of inflammation, though these require careful evaluation by a healthcare professional. Finally, surgery is reserved for cases where all other treatments fail. Whether it's correcting a structural deformity or addressing a chronic issue like severe arthritis, surgical interventions can provide relief when conservative methods aren't enough. The key to effective foot pain management lies in combining these approaches based on the root cause of the problem. By addressing both the symptoms and the underlying issues, you can achieve long-lasting relief and regain the freedom to move comfortably. If you're dealing with foot pain, do not let it stop you from living your best life. Explore these treatment options with your healthcare provider to find what works best for you. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit. For personalized advice, feel free to reach out. I'll be happy to help. Let's stick to a pain-free life, one step at a time.